Assalamualaikum and good morning to my dearest lecturer and beloved friends. We from Group 3 will be presenting about animal testing should be banned in biomedical research. Firstly, we need to know what, why, and what is the issue that urged the ban of animal testing. So what is animal testing? It is a method to evaluate drugs or cosmetic products on animals before producing them to be consumed by humans. And why is needed to do animal testing? To be tested on newly developed medicines, and it is said to be a promising treatment because some human disease can be found in animals. Then what is the issue that causes the ban of animal testing? According to Kabin and Badil 2019, the action of using animals in experimentation has led to harsh condemnation from animal rights and protection groups, which is claimed as unethical, which causes pain to animals, and the advantages to humans are unproven. Not just that, it was said unnecessary as the product will be tested on humans as well. Therefore, it is undeniably true that this method has contributed to the successful production of drugs and treatments. However, despite the success, is it necessary to undergo this method for the breakthrough? Hence, animal testing within the biomedical field should be terminated because animals are poor predictors of drug safety for humans. The testing is a waste of money and the animals are facing cruelty.
Moving forward to the Sustainable Development Goals. The discussion on animal testing is in line with SDG 3, which advocates good health and well-being for all, and also SDG 12, focusing on responsible consumption and production. The SDG guidelines should be followed to ensure the utmost level of safety for all.
The first main idea in relation to this topic is that animals are poor predictors of drug safety for humans in the medical industry. The first claim to support this idea is that preclinical toxicities found in animals and clinical toxicities reported in patients do not show strong correlation. A study by Atkins in 2020 has mentioned that toxicities are evaluated differently in animals and humans. Furthermore, the study also mentioned that several toxicities that are common to humans are underreported in animal toxicity studies. The second supporting claim to support this idea is that most toxicities found in animals were not reproducible for humans. Toxicities other than carcinogenesis were not reproducible between animals like rodents, between the sexes, or compared with historic control animals, as stated in a paper by Norman in 2019. In addition, a study in 2015 by Akhtar stated that human diseases are usually artificially induced in animals.
Moving on to the main idea 2, which is using animals for biomedical purposes is a waste of money. First, animal testing requires a high investment for preclinical studies. This can prove by the statement from Fontana et al. 2020 that researchers need to pay to get certification or concurrence from the official organization. Next, the animals' accommodation needs to be prepared before utilizing them for experiments such as cages, food, etc. The charges also depend on the intricacy of the experiment. The more intricate it is, the higher the investment is. From here, we can see that it took a lot of investment from the beginning. However, preclinical research supposedly gets the most knowledge with the least amount of money. Secondly, repetition of the experiment. Preclinical studies involve the repetition of experiments whereby the drug development is not expected to succeed in the early phase. Therefore, the experiment is repeated for years to get the best result. This repetition process has led to a significant loss of money, time, and animal life. So, for example, cancer medication drug development took 4 to 5 years with rodent testing and cost $2 to $4 million. Based on the global market for the animal testing statistic in 2018, it is estimated to be $7.4 billion for drug discovery, $11.2 billion for preclinical development and safety, $58.5 billion for clinical development, and $2.3 billion for central laboratory testing. Thus, this proves that the animal testing method is not comprehensive enough, that is worthy of time and financing matter. Hence, banning animal testing could avoid a waste of money.
Moving forward to main idea 3, which is the banning of animal testing can avoid unwanted animal cruelty. Firstly, animal cruelty must be avoided at all costs, as research has found that animal cruelty is closely linked with other forms of violence, mainly being done toward human beings. To prove this statement, according to Kellert and Feldhaus 1985, as cited in Longobardi and Badenes Ribera 2019, aggression towards animals has a few motives, with the first one to have control over and influence the animal's behavior, which is then can be translated into actions towards human beings. The other motive is to using these animals to show violent and hostile conduct towards other persons or animal. In addition to that, another form of violence based on animal cruelty includes interpersonal and domestic violence. A statement made by Gullen and Clark 2008, as cited in Cleary et al. 2021, mentions that 11 out of 20 of those jailed for animal abuse had a history of domestic violence. Secondly, animal cruelty must be avoided as it contributes to animal suffering and neglection of their welfare. Animals suffer as a result of being utilized in the name of education and research. More often than not, these animals will be left suffering without any painkillers after each experiment. In some cases, extreme methods are being used for their participation. According to White 2019, to ensure the participation of animals in each experiment, their food and water are restricted. It is expected to motivate these animals to perform during experiments. For these reasons, the banning of animals used in experiments is considered a necessity to put an end to animal cruelty.
In conclusion, the consequences of animal experimentation in the biomedical industry outweighs its benefits. Animal testing results are not fully reliable for medicine production, not worth investing in, and the possibility of unwanted animal cruelty. Hence, banning animal tests could ensure safety and rights for both humans and animals. In addition, there are several recommendations that can replace animal tests in the biomedical industry. The first option is by utilizing supercomputers, since this machine is capable of producing accurate simulations to identify a drug's risks. The second option is the use of in vitro method, which often shows accurate results due to strict control of the environment. The third option is analytical method, where a drug's risk is easily identified with the help of specialized instruments.
And the earth he laid out for the creatures. Surah Ar-Rahman verse 10. Animals have the right to the earth as we have. God has created them, various creatures, and we, as Khalifa, should not harm the creatures. Thank you.